Okay, before we go into any yielding kind of movements, let's talk about what a yield is. That is the part of a faster paced or plyometric type of movement when your body has to be able to accept the shock, adapt to the ground, and kind of catch your body weight, right? So it's that part of the kinetic energy where your tissues are lengthening, accepting the weight and the ground reaction force to then transfer it into energy to fire it back up, right? So in terms of pelvic floor, that's an important part of the puzzle, right? Retraining that ability to accept and catch, right? That bottom part of the motion is really important to be able to save some of that energy we're creating to then effectively be able to leave the ground or spring the weight back up. Okay, so all of that is stored energy. What happens a lot of times if the pelvic floor is weak or tight or just not able to be stable through its full range of motion, that is when other muscles will have to kick in, so compensation patterns will arise, or you'll get some pelvic floor, pelvic health type of symptoms like leaking or heaviness from prolapse or pain or pulling or things like that that are going on. Okay, so the full plyometric motion again is to be able to land on the ground, accept your weight, pause, connect, collect all that energy, that stored energy, which you have no idea this is happening. Your muscles and tissues are just doing it. Then to be able to transfer that back into the springy motion. So to get that springy bounce back into our body. So the yielding part of it is to retrain this part of it. Kind of like that quicker catch where your muscles and tissues, especially pelvic floor, have to lengthen but still be stable, right? So that will then be able to get you here effectively.